AARP survivors of stroke. I'm going to be talking today with certainly an expert in stroke diagnosis, treatment, and preventive measures, Dr. Erik Tarula, who specializes in neurocritical care with special interest in stroke from UW Health. So, welcome. Hello, Dr. Tarula. Thanks for joining us today on World Stroke Day.
Hi, thank you for inviting me.
It's great to have you. It's great to have you here. I know this is going to be a topic of interest for our audiences, and it really does impact people of all ages, which I think is something we'll get to during today's conversation. So, first of all, I think the audience all will want to know, why should I care about having a stroke?
I think one of the reasons is that it's just so ubiquitous. I mean, it's worldwide, and we're talking about World Stroke Day. It's the number 2 reason for death in the world. In the United States, I haven't seen the latest numbers. It's about number 4, number 5 in the United States, and it's common enough that as you can see here, some stroke facts. This is from the NIH website. Someone suffers from a stroke about once every 40 seconds. Right.
Yeah, I mean, that's incredibly ubiquitous, and it's not something I think many of us talk about. Certainly, when you talk about higher profile diseases that get a lot of attention, certainly, at least I know personally, that's not usually a stroke is not usually a topic of conversation amongst most of our members. So that's really fantastic information. Again, if you're just joining us and watching our live stream, you're with Dr. Erik Tarula from UW Health. And we're talking about World Stroke Day to raise awareness of strokes and the impact on individuals. How do we prevent stroke? How is stroke treated? And what are some easy ways for us to better understand what happens when a stroke occurs? So that's the great segue, Dr. Tarula. What is a stroke, in fact?
So stroke is kind of an umbrella term. There's really 2 main types of stroke. One is and the most common really, is the ischemic stroke. That's when there's lack of blood flow to the brain, okay, to one specific vessel or multiple vessels, really. And this can be caused if people are much more aware of like a heart attack. People have now used the term brain attack to raise more awareness for strokes, actually. So now people use the term brain attack. So much like a heart attack, where there's lack of blood flow to the heart from diseases of the vessels, the same thing can happen with the brain.
Yeah, I think that's a really simple way to define it.
Yeah.
Which is a great thing. We had ischemic stroke. Now, what's the second type we want to talk about today?
Yeah, and so the second type of stroke is hemorrhagic strokes. It's much less common. About 15% of strokes are hemorrhagic type. And this is when a blood vessel bursts. So there's actually hemorrhage within the brain itself. They both have similar risk factors. So they're both kind of clumped together. They're both diseases of the vasculature of the brain. And the simplest way I like to think about it, it's kind of plumbing. So when I talk with patients, I talk about plumbing, most commonly with ischemic strokes, when I say like, what happened, doctor? I usually say, well, the simplest way is that the plumbing is a plumbing issue. And I'll say like, one of the pipes got clogged off, and it happened over time, and things just built up in the pipe walls, and then it got occluded, or someone threw something down the pipe they shouldn't have. So those are kind of what we call embolic strokes, which can happen from various diseases of other arteries, mainly the neck, or heart conditions as well.
That is definitely a much easier way of understanding it. And for those of us that can be a little intimidated by the words ischemic and hemorrhagic, talking plumbing
Mhm.
certainly
Yeah.
brings it into a much more real realm, I think, than most of us can understand.
Yeah.
I'm really curious and fascinated. So you certainly are extraordinarily knowledgeable about strokes and other issues. How did you get into this particular field of medicine? What was it in either in your life or your studies that made this the topic of your that you wanted to be an expert in?
Sure. Well, I was always interested in the brain, and I felt the brain was a organ that still remained, and still to this day remains quite mysterious compared to any other organ. And I was a neuroscience major as an undergrad. I decided to go to medical school, and there I left my options open, but I fell in love again with the brain, which led me to be a neurologist. So I did my general training as a general neurologist. Um, and then during your training, you can kind of choose to pursue further training afterwards. And for me, I liked kind of the fast-paced nature of critical care medicine.
Mm.
And that led me to do a fellowship training. So there was 2 extra years after my general neurology training to do critical care, actually neurocritical care training. And I did that. I had completed those things both in Chicago and here in Madison, Wisconsin. So those were just 2 years there. And so I deal with not only strokes, but other neurologic emergencies.
Mm.
So I deal with basically all neurologic emergencies and general critical care emergencies. But because the numbers are so high in terms of stroke, what we're talking about, most of my patients are stroke patients.
Fantastic, and it's great background. And I can't imagine the number of years that all of those experiences equate to, but they certainly add up to a great deal of knowledge and expertise that you're sharing with our audience today. So we certainly thank you for that. So we've talked about why should we care about it? We've talked about what kinds of strokes there are. So I guess the next logical place to go is how do I actually prevent myself from having a stroke?
Yeah. So a lot of people again talk about heart attacks and what can we do to prevent heart attacks. It's really around this. It's the same thing with preventing a brain attack. So in this slide here, it goes over some of the kind of the basics of preventing a stroke. And that goes with just living a healthy lifestyle, making sure that we get enough exercise, that we're eating well, kind of a balanced diet, rich in vegetables and fruits and whole grains, controlling our blood pressure. That's a big one. Along with exercising, just maintaining a healthy weight. Smoking does not only damage to the lungs, but also does damage to the vessels themselves. And we're talking about the vessels of both not only the heart, but also the brain as well. And then just making sure that we reduce our alcohol intake and managing other things such as diabetes, diabetes affects multiple organs and including the nervous system and the blood vessels. So managing our diabetes well if we happen to have diabetes.
Well, that certainly gets to one of our first questions in the chat today off of Facebook is how can the way we eat and diet help with stroke prevention? And I think what I hear you saying is sort of that term we use, a heart healthy diet is probably also a brain healthy diet, if I'm
Yes.
saying that right.
Yes. So with diet, there's a lot of things in diets that can be pro-inflammatory. So inflammation can cause issues in the body, not only just in terms of the brain, but everywhere else. With diet comes your cholesterol. So if we're eating, a diet heavy in cholesterols and, for instance, animal fats, red meats, those cholesterol, especially if it's high, will deposit. It needs to go somewhere. So again, going back to the plumbing, something that I tell people, well, this is what's happening with the plumbing over years. It's building up in the walls of it, and and it takes years for this to occur. Most people don't.
Yeah.
This isn't a disease where people are saying like, oh yeah, I feel bad, like I had too much cholesterol there, or I had, it's a silent disease, much like high blood pressure as well.
Yeah, it's just fascinating to me as you're making these, equations between heart and brain health. I think about all the times we talk about cholesterol, and it really revolving around the heart, or like heart blockages. And it just it really is a fascinating thing to think of it as there's vessels all over our body, and cholesterol, as you said, is traveling all throughout. It's not limited to just your heart. So just really great information. So I guess for most of us, we're looking at that list of risk factors and we're calculating in our brains, um, okay, I feel like I'm pretty healthy. Do I need to worry about having a stroke anyway if I'm not engaged in some of these higher risk factors? So am I good to go?
Yeah, I wish that were the case.
Oh,
I
okay.
mean, so strokes actually affect everybody of every age group. So we have, much like I'm an adult specialist. We have peds on the pediatric side. We actually have stroke specialists on the ped side,
Mm,
because strokes, again, are a vascular issue, and you can have multiple things that are going on that can make you at risk for a stroke. On the adult side, genetic risk factors that we just can't control, that are beyond our control. So one thing to look out for is, let's say, if one of your parents had early onset strokes or heart disease, that can be a red flag for, like, am I a higher risk factor for this? And a lot of this actually just does go back to blood pressure and cholesterol, which again are silent diseases because we don't feel them. Much like, actually, just like plumbing, right? We don't know that there's a plumbing issue until
true. Yeah.
until something stops working, right? Um, so it's the same thing. We don't know until something stops working. Uh, and the other kind of big risk factor, especially for older adults, is going to be atrial fibrillation, which is, again, I'm talking a lot about the connection between the heart and the brain, because there is a big connection there. There's atrial fibrillation when the heart has an abnormal rhythm. And because the heart has an abnormal rhythm, there's a higher risk for clots to develop in the heart. And then they shoot somewhere. They got to go somewhere. And because a lot of blood goes to the brain, we see strokes happen from that. And atrial fibrillation, sometimes we don't know all the risk factors for that either. Some of it has to do with high blood pressure, lung diseases, like people who are heavy smokers, or even just heavy alcohol use can predispose you to heart issues like atrial fibrillation. And these things aren't always apparent. So people can live with atrial fibrillation and have no idea that they have it. So every once in a while, I'll have a young person with a stroke in the hospital, and we've tried to figure out, when we talk about stroke prevention, we say, well, why did you have the stroke to begin with? Once we know why it occurred, then we can tackle, well, how do we prevent another one from occurring? And sometimes, every once in a while, we say, well, the reason is you have atrial fibrillation, or this abnormal rhythm in the heart. I said, well, I never felt it. And I'm like, yep. Some people don't feel it at all. Other people can feel it. They either fatigue, a racing heart. They're like their heart is jumping or skipping a beat. But for a lot of people, they actually have no idea that they have it.
Amazing. For those of you just joining us, either through Facebook.com or our YouTube channel, viewing our live Thursdays with AARP Wisconsin feed, you're listening to Dr. Erik Tarula, who specializes in neurocritical care with a special interest in stroke at UW Health. And today is World Stroke Day, where we're trying to get more information on the serious nature and the high rates of stroke in our population, and find out more about how we can actually prevent strokes from happening in our lives and those of our loved ones. So we've talked a little bit about, or at least you've sort of teased the idea of how do we recognize, maybe, continue to use the analogy of plumbing. Sometimes you don't know it's happening until something major happens. But then I heard that you can maybe feel your heart skipping or something like that. So, what are the signs and symptoms of a person who's having a stroke?
So there can be multiple signs and symptoms. The ones we tell people, and we're now getting it out into public, so you actually may have seen these billboards around or these signs around. We call it be fast, right? Meaning the common signs and symptoms of a stroke, and they don't have to happen all together. Each one of these can be a separate sign that a stroke is occurring. And I want to make sure that people know that, just because it occurred just for 5 or 10 minutes and gone away doesn't mean that you're not at risk. And I'll talk to you about that a little bit, maybe in a couple of minutes. But the signs and symptoms are balance. If you all of a sudden have onset of unsteadiness, feeling like you've, either on a boat or had too much to drink and have no reason, that could be a sign of a stroke. If you have trouble with vision, right? Most people will say like double vision, or they feel like one eye just has less vision. That can be signs of a stroke. And sometimes actually the patients themselves don't even realize there's a visual issue. If there's a facial droop, so along with the facial droop, like slurring of the speech, right? If there's weakness on one side of the body, so a lot of times when we're doing a stroke evaluation, and we can do a stroke evaluation over camera as well. So we do have a telehealth program as well here at UW. We'll have people raise up their arms, and we'll see what, if one arm is drifting or just not as strong as the other side. Again, I said speech, if there's slurring of speech, or if the words just aren't making sense. A lot of people say, yeah, I was talking gibberish, or my loved one was talking gibberish. And then the last part is time, because it's an emergency. So again, the acronym that we're using, and you'll see these things around hopefully more and more, is be fast.
Well, to your point about time, is every stroke a medical emergency?
Yes, every stroke is a medical emergency. When you're having a stroke, and if that blockage doesn't get opened up, you're losing brain cells every minute. All right, and it's been estimated around 2 million brain cells die after every minute. So these brain cells actually start dying within about 4 or 5 minutes of lack of blood flow. Brain cells actually start dying, and then from there on, about 2 million every minute afterwards. Now, there's a lot of brain cells, but again, time equals brain. So we want to make sure that everybody understands that every stroke is an emergency. And what I was alluding to earlier too was that sometimes, let's say you have a plumbing issue, like one day, let's say your faucet isn't giving water, but then you go ahead and try it again, and now it's giving water. It's like, all right, well, a lot of people will ignore that. Like, I don't know what that was. It's working now. That's exactly what can happen in a stroke as well, where you can have one of these symptoms, one of those kind of be fast symptoms, balance or eyes or facial droop. It can only last a couple of minutes, right? And then someone's back to their baseline, and they go, I don't know what that was, and they kind of just ignore it. Yeah. That happens quite a bit. Very often, actually, too often. And so people ignore it, and then they don't seek help. They actually at that moment were suffering a stroke, and either that vessel reopened by itself or another vessel took over. But that also means that they're at a high risk of having a stroke within that next week.
Interesting.
And that's what we call it. People refer to these as mini strokes. In the medical term, we use TIA, or transient ischemic attack. But a lot of people call them the mini strokes. But those are also medical emergencies. So when someone shows up here to our hospital with quote unquote a mini stroke, we actually treat it just like an emergency. A lot of times they either get observed here or spend at least 24 hours here in the hospital.
Okay, so I've got a question in chat I want to get to about reversing the damage. So I've heard that there's sort of like this critical window when somebody has a stroke that they need, if they can get to the hospital in X amount of time, then the chance of recovery is whatever percent greater. So you'll know all of those details. Mm-hmm. So I want to get to that, like, what's that critical time frame? And then the question in the chat was, is there something they give stroke patients that can actually reverse any damage that happens? So these brain cells that die, as you articulated, is there something to reverse that? So I guess that's a two-part question.
Yeah. So there are treatments available. So if you are suffering a stroke, again, time is brain. So we want to get to you as fast as possible. Those treatments are, one is medical, the other one is surgical. The medical treatment that we can give is a clot busting medication. People refer to it as TPA, or the clot busting drug. That can only be given in most cases within 3 hours. In some other cases, up to 4.5 hours. So we're dealing with a very tight time window here. For most people, it's about 3 hours. Again, the reason for that is that we want to make sure that we can open the vessels up safely without side effects using these medications. Now, the other treatment that we have is surgical, where we go up, actually it's called endovascular. So we actually go up with wires up into the brain, and if we see a big enough clot, we can grab it and pull it out. And those we can do that up to 24 hours, depending on an individual by individual basis, actually. And again, just because, again, we can do this up to 24 hours doesn't mean we just wait, because again, every minute things are dying. Now, some of these, along kind of with that was a two-part question. What's the treatment, and how can we reverse some of this stuff, and how can we save some of the cells? Some of the cells just don't die; they actually just come offline. Just think about something just having a low battery, like a low battery power.
Okay.
Right. Not quite working. It's kind of coming in and out, that type of thing. Yeah. But we can save it. So if we can put the batteries back in, it'll jumpstart again. So some of these cells may come down. If we can reverse, or we can restore blood flow fast enough, those cells get their energy back, and then they become, their nice healthy selves again. And that's where we see those short recovery, specifically kind of in the shorter time window while people are hospitalized. And then afterwards, recovery is time dependent. And unfortunately, at this moment, other than preventing another stroke and physical therapy and rehab, there isn't much we can do at this time. There's no other therapies where we can inject more cells. We can give a medication to help these cells become healthier. We're not there. We're not there yet. We're certainly working on it from a research side, but we're not there yet at this moment. So after that, it's time and letting your brain's plasticity, what we call, so the brain actually can change and mold, letting nature actually do much of the healing. But that takes usually weeks to months.
Yeah, and that's what I was going to say. When can you what should the expectation of a loved one or the person who themselves has had the stroke be for recovery? And I guess you're going to tell me it depends. But are there certain factors that you would say these people tend to heal a little quicker than others, or is it just, as you said, it's a mix of genetics and the environment and, timing and everything else?
Yeah. And so it is, it's a mixed bag out there. So again, we'll have some people who can recover quickly. As an example, when I was a resident, I was lucky enough to train at one of the Harvard hospitals. And one of the surgical residents actually had a stroke while working in the morning. So it was 7 a.m. doing his job. He was having a major stroke. Now, he happened to be in the hospital at that moment. So he got treated within an hour, pretty fast. Everything, got medication, got the surgical treatment, and he was back to normal the next day. Actually, by that night.
Wow.
So that's an example of someone who, if he didn't do nothing, the person probably wouldn't be here today. So, so it guess depends, again, with the plumbing issues, like you could say, well, it's just the faucet, or a little leaky valve needs to be replaced, or like we got, your septic tank.
Yeah.
So it really is a mixed bag. So some recovery can happen early on. Those are, I think, rare because we had to get to the person fairly quickly. Since so the medication is actually available everywhere. So most hospitals, rural, small community hospitals will have this medication, and most, if not all, will have access to a neurologist through telehealth. So through the actual video, where we can advise doctors, ER doctors, whether or not to give medications. The surgery, though, can't right now. We don't have enough trained people that they supply. All of Wisconsin, for instance.
Yeah.
So those are only at specific locations. So like UW happens to be one of our few of Wisconsin's comprehensive stroke centers, meaning we can handle all strokes day, night, 24/7 here, and even multiple at the same time. There's only a few comprehensive stroke centers throughout Wisconsin, and then there's only a few centers that can even offer a surgical treatment for stroke. So a lot of times we get people flowing over. So we have a helicopter system here that goes everywhere, including the Upper Peninsula of Michigan, and brings patients here. So a lot of times, yes, we will fly people just to get them here as fast as we can, so we can treat them. Yeah. After that, if again with strokes, we can do what we can early on, and then after that, if you have some other issues, that again, it just depends on how big of a stroke and where the location was. That depends. That influences your recovery, and it can be anywhere from days to weeks to months, and sometimes up to like 12 months in a year and beyond. And as an example, I had a young person. She was 30 years old and was having a stroke. Got the clot busting medication at another hospital, was flown down here. By the time they got here, there wasn't a clot to go after, meaning the medication worked. She still had suffered a pretty big stroke and had left her with the inability to talk. When I saw her again about 6 months later, she was talking somewhat. When I saw her again 6 months after that, she was talking much better, but not normal. And then when I saw her again 6 months again afterwards, she was talking normal. Like I couldn't tell.
Well, yeah, I think that's I think a great hopeful message for people who, I think maybe in the past, those of us have had experience with maybe our grandparents where treatments weren't quite as advanced as they are today, where stroke damage felt very permanent, right? And that there was little, chance of improvement. It certainly sounds from you that there's a lot of hope for folks if you can, again, catch it in time and get the treatment started. Just a fascinating discussion today on World Stroke Day with Dr. Erik Tarula, who specializes in neurocritical care and special interest in stroke at UW Health. I know we're getting to the end of our time together. I guess before we get to your last thoughts on where people can find more information, is there anything on the horizon that you're really excited about in the treatment of stroke? Is there something that you, in the medical journals or whatever, you're looking at and saying, boy, this could really be a game changer for folks?
Nothing on the immediate horizon. I think the last things, actually the things that have changed recently are our imaging capabilities have improved quite a bit. And again, those surgical procedures that we do now for stroke, that's been within the last 10 years. Okay. So when I started training here, we weren't doing it on everybody. Now we're doing it on most people when we can. So that's fairly new. And again, that's the reason why it's not available everywhere at the moment. Yeah. So that's been a big game changer in stroke. In the horizon, we'll see what we can do, whether it's stem cells or what we call something called brain-computer interfaces, where we actually can hook up a computer to your brain. That will be a thing. It's already a thing, actually. But that's something that's, I think, quite exciting in the horizons. But I think, rather than focusing on, the treatments of it, I think we can't ignore is I think the best treatment is prevention in the first place.
Always.
Yeah. Don't suffer it. So again, making sure when something goes wrong that you're addressing it. So don't just, don't treat your body like a car where the check engine light goes on, you just keep on going. Make sure you take care of it because you only have one.
Well, we've had some great illustrations from car maintenance to plumbing and a couple others in between. So thanks for making it simple for all of us to understand. Again, on Facebook, comment. Thank you, doctor. It's been very interesting. It certainly has. Is there a place you'd like to tell people to go to for more information following them watching this program if they would like even some more information on strokes, prevention, treatment, and so on?
Yes. So the American Heart Association actually, you have it at heart.org. It has a lot of resources for patients, both on heart care and brain care. So they're actually a pretty good resource to go to, and it's pretty easy to navigate.
Well, good. It's a simple website for people to go to, and you've talked about the connection between your head and your heart all throughout our discussion today. So I just want to thank you, Dr. Tarula, for spending time with us. It's been fascinating, informative, and also hopeful for a lot of people. And certainly your message of prevention will resonate with folks to make sure that they are doing all of those things to eliminate as many variables as possible to getting a stroke. So we appreciate you coming on with us today on World Stroke Day, sharing your knowledge with us. So thank you so much for joining us.
You're welcome, and thank you for having me.
Much appreciated. And again, for all of you watching today, make sure you continue joining us on Thursdays for Thursdays with AARP Wisconsin, where you can watch our live feeds through Facebook.com and our YouTube channel. A lot of great content coming up in the month of November. Certainly next week we'll have guest Abe Lennox from a Thousand Friends of Wisconsin, talking about Wisconsin active living throughout the state. So it's sure to be another fantastic program from AARP Wisconsin. So thanks to everyone for joining us. We hope you enjoyed the content this week, and we hope to see you in future weeks as well. Take care.